In this video, I will introduce you to PROMPT, our Electronic Medical Records System, or EMR system. We use this for many things in our clinic, to complete documentation, to schedule patients, but what you use it for is to refer to the schedule each day in order to coordinate your work. At first, I want to show you a couple of tools that will be helpful to use. First of all, you want to make sure the facility matches which clinic you're working in. Second, you'll want to make sure that the providers match what your schedule will be for that day. You'll see this little green icon here that I've clicked. That will pull up only the providers that have scheduled visits for that day. When I click this drop down, I can go and add and select even more providers. For example, I don't have any patients scheduled on this day. You can see the total number is 0 up here versus Chelsea seeing 9 or Rich seeing 14. But if I click this button, you'll see that my name disappears from the list. This is a quick way to find who you want that will be on the schedule for that day. If you have somebody who only works in the afternoon on that given day, and you'd like to only focus on the providers in the morning time, you can come here and you can always deselect that provider if you'd like. But don't worry, you can always add them back in later. If you're ever looking at a different day for whatever reason and want to go back to the day that you're at right now, you just click this Today button and it will take you right to today's date. And one other feature is that you have the ability to hide visits that show cancellations. I know a lot of times our exercise specialists will do this because that helps them focus on the patients that will be arriving. However, if you want to be able to see who canceled and be aware of their plan of care, for example, this day this patient had canceled, then you can hover over here and see that she had the flu that day and wasn't able to attend, which might be helpful if you're wanting to reach out and connect with her the next time she comes in the clinic and share your condolences for her illness. Well, the most important part of the schedule is understanding how this helps your flow and helps you in your role. So let's talk about the different visit types. You'll see the most common one here is in green, and it's marked as a follow-up visit. These are what we call follow-up or daily visits, where patients come in, they have their usual setup, they have their usual hands-on treatment if that's indicated, and they have their usual exercise program. Obviously, we'll be advancing and tailoring whatever portions of these that need to be done for any given day that they come in, but nothing will change in your flow. The next one we want to introduce you to is this re-evaluation visit. This will be the same as a follow-up visit. However, in addition to that, we will also have the provider that's working with them perform tests and measurements to evaluate how they're doing with their current plan of care and to make decisions with that patient about extending or terminating or changing their plan of care. The other thing to note is that this might push some patients a little bit behind their normal flow. And so this might require us, as we talked about earlier, to have conversations about how long a patient should stay and which exercises we should prioritize on that given day so that we don't mess up the flow and that we can focus on giving all the other patients that come in thereafter at this time slot the best of our ability. You also see these ones in blue. That one indicates an initial evaluation, and this is our only visit type that is 1 hour long. This is not something that you'll participate in almost ever, but that our providers do with our scribes one-on-one to be able to work with the patient, understand what's going wrong and understand their diagnosis, and be able to create a plan of care to be able to help them recover. It is important, however, to consider that these are performed in rooms, and so when we look at making decisions on where to place these patients, for example, if I'm doing setups for these patients right here at this time, I want to make sure that I'm mindful that I have a room so that our provider can work with this patient for their evaluation. So look ahead at the schedule, be mindful of who you're putting in which rooms to be able to coordinate and help together. You'll also see ones this purple color. This indicates their final visit where they're discharging and being able to graduate from our program and go back into the world and do all the things that they want to do. And this one indicates that the patient is a pelvic floor patient. So they'll be likely working with any of our pelvic floor PTs. For example, Corianne at this given clinic is a pelvic floor specialist. I'll be working with that patient that day. Also consideration that typically, especially if we're doing more sensitive or intimate treatments on somebody who has issues with their pelvic floor, that we make sure that they have a room where they have discretion and privacy. We can talk about that more as you have questions. The last visit type, it's not represented on this day, but I'll also show you the last tool here. You can click on this and go to a different day. I'll toggle over to the next month. We'll look at it here on Monday. So I'm going to add myself back in. You'll see that we have dry needling here. Dry needling is a technique similar to acupuncture, and the important thing for you to know as an exercise specialist is that at our clinic, when somebody has dry needling on that given day, we do not start with their typical heat setup like their usual visits. Instead, we get them started on exercises first and incorporate dry needling during their typical manual therapy time during the one-on-one sessions with the provider. They still perform all the regular exercises like normal afterwards, but sometimes if dry needling goes long, we again have to have those conversations about focusing on which exercises we want to prioritize. Now, the biggest thing to focus on with the schedule is to look ahead and anticipate needs and keep the flow. For example, a second visit is actually another type of visit it's really important to know about. These happen after the initial evaluation happens, and we can expect that a patient will be new to our facility or new to some of the exercises that we have for them that day. Because of that, we view this second visit as a handoff visit from the provider to the exercise specialist team. That patient has developed a trust with the provider because they got to spend an hour with them in an evaluation. Now it's our turn to transfer that trust over to the exercise specialist team in order to ensure that they trust our whole team, as that's who they'll be working with at any of these follow-up visits. Some of the things that will be different in a second visit are that we encourage our providers to try and take the patient through some of the first few exercises, especially the ones that might be a little more complicated or that the providers might be less certain that the patient will perform well on. That will also help in the flow of things, as second visits can take a little bit longer at times because we have to coach the exercises and the form a little bit more. Because of this, even if a provider writes 8 or 9 exercises on their chart, if we're getting to about that hour mark and we've only completed 5 or 6 exercises, that's okay. We made sure to teach the patient the right way to do these things, and we focused on what was most important. So be mindful of those second visits as well. Plan in some extra effort and time with that patient to ensure that they're doing those exercises correctly. You also see double booking slots where 2 patients are booked on one provider slot at the same time. We hope to keep these rare, but when they do occur, just know that it'll feel a little extra busy at times and that you'll have to definitely anticipate and plan ahead and work together with our provider staff to ensure that we're treating everybody with efficiency and with quality. Again, one thing to do is anticipate. So if you have needs that are ahead and you start to recognize we have a lot of patients that need tables, then be mindful of asking questions to those providers. You might have somebody who normally lays down on their back, and we might not have enough tables for them to lay down that day. So you might ask that provider, hey, this person seems to be doing well. Is that okay if I set them up in a chair today? I don't think we'll have table space for them. That provider can then either sign off on that or make a call to keep them on a table, and we can get creative about figuring out how to use our table space more efficiently. This is just a specific example, but in general, we want to be able to look ahead and anticipate needs and be able to solve problems before they happen.